So we'll call the meeting to order. If you're able to join me in standing and for the Pledge of Allegiance, please join me. I pledge allegiance
to the flag
of the
of
United
the
States
States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Roll call, please, Dee.
Director Yee,
Present.
Director Stewart,
Present.
Director Wallace, Director Epen, Director Nicholson.
Present.
Very good. And who's in the room with you there, please, Dee?
In the room, we have Kimberly Hart, Ed Fayen, Chris Henry, Tina Nunez, Larry Labossiere, Erica Luna, Shri Badu, and me, D'Antonio.
Very good. Thank you very much. Well, welcome to the June 22nd, 2022 regular meeting of the Washington Township Healthcare District Board of Directors to continue to protect the health and safety of the members of the board, district staff, and members of the public from the dangers posed by the SARS-CoV-2 virus. The Brown Act allows a local agency to continue to hold its meetings remotely as opposed to being required to meet in person. Section 54953E3 of the Government Code requires that the board make certain findings every 30 days to continue meeting remotely. One such finding is that, quote, state or local officials continue to impose or recommend measures to promote social distancing, end quote. The Alameda County Health Officer continues to recommend social distancing and the wearing of masks indoors. I refer the public to the Alameda County Healthcare Services Public Health Department COVID-19 website at www.covid-19.acgov.org. The board made such a finding at its meeting earlier this month. Public notice for this meeting, including dial-in information, has been posted appropriately on our website. Tonight's meeting will be conducted by Zoom, and I ask that you please mute your system until such time as you need to speak. Moving on to communications, members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within the subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Now, are there any written communications, Dee?
No, there are not.
Okay, very good. Then we'll move on and with the agenda for presentations. Kimberly, will you do the honors, please, of the introductions?
All right, this evening we are presenting for recommendation to the board for approval the budget estimate for fiscal year 2023. This evening, Chris Henry and Erica Luna are going to be presenting the budget to the board of directors, and I'm just going to give you a little bit of an overview of each of them, their backgrounds, and then make a few comments before Chris Henry begins. So I know most of you are very familiar with Chris Henry. He's the Vice President and Chief Financial Officer for the healthcare system. He is a certified public accountant, licensed in the state of California. He has served as Chief Financial Officer of the district since October of 2006 and in other management roles for the district from May 2000 to October of 2006. Mr. Henry is a member of the California Society of Certified Public Accountants, California Hospital Association, and the American Institute of CPAs. He holds a bachelor's degree in business administration with an accounting emphasis from California State University, East Bay. Then Erica Luna will also be presenting this evening, and she is our Assistant Chief Financial Officer and has responsibility for the day-to-day operations of the Finance Division, including direct oversight of financial planning and analysis and treasury. She earned a Bachelor of Science degree in finance from Cal State East Bay and has many years of experience in healthcare finance before joining the district in September of 2018. So just to introduce the budget for this evening, as mentioned, we'll be presenting the fiscal year 23 budget. I think most of you know that over the last 2 years, Washington has experienced some unprecedented economic challenges during this COVID pandemic. However, over the last number of months, the situation has been improving, and I think a lot of it is given the vaccination and the rate of vaccination percentage that we have in Alameda County. But I think what we're all most aware of is that COVID is not going away, and really we must live with this new normal. And so this past fiscal year 22, we've really spent a great deal of time incorporating many of the operational changes related to COVID into our normal day-to-day operations. And also we work to very much stabilize the operations. And so moving forward into fiscal year 23, we still have a great deal of work to do in terms of improving our operations and laying that foundation for future success of the healthcare system. In terms of the operations, we're going to continue a lot of our work that has been done in terms of cost savings, but also really focusing on that revenue improvement, looking at our care coordination, our utilization management, and our revenue cycle processes in terms of ways that we can improve them, along with the quality of care for the whole healthcare system. I think that, us, like many hospitals, not only in this county, but throughout the state of California, we are facing ongoing challenges, and especially as it relates to our retention and recruitment of our workforce, our staff, and our physicians. And it is something that we've been seeing the turnover rate go up. We have been experiencing some of that great resignation that others have been experiencing. So it is something that we need to continue to focus our efforts on. I do feel like those who have left this organization, the majority have left because they want to be closer to family members or relatives, or feeling like it was time to retire after many of the challenges faced by the pandemic. We've also many have been impacted by supply chain challenges. I think we've heard about it in terms of contrast and also other types of supplies that have been difficult to get our hands on, and we've had those challenges throughout the year, and we see some of those continue, along with increasing costs in supplies, especially around drugs. And then the economy at this point is unknown, and I know Chris will be addressing some of that as to, the impact of inflation and some of the other challenges that we're seeing. Even though there are many unknowns and there is some uncertainty, I think what we do know is that it is very important to maintain our financial health so that we can ensure that we meet the needs of our community now and into the future. But I also just want to say and thank all of the staff and the physicians, because each and every day they come to work and they show their compassion and their resilience and hard work for our patients, and ensuring that they get the care that they need from their local community hospital, Washington. So with that, I'm going to turn it over to Chris to give a little bit more of an introduction and talk about the environment.
Okay, thank you very much, Kimberly. There's a lot of work that goes into this budget, and I really would be remiss if I didn't make some acknowledgments. I want to thank Erica Luna and Dan Nardoni. There's just an enormous amount of information that needs to be gathered and compiled and turned into a format that we can somehow digest. And there's been a lot of work and a lot of hours with those two getting just that done. So thank you to Dan and to Erica. I need to thank my colleagues, Ed Fayen, Larry Labossiere, and Tina Nunez. There's a lot of their input into this budget. They're the ones working with us to tell us what they need and making sure we get it in there. And again, that's a lot of work from them. So thanks to the three of you. Also, really the entire hospital management team has a piece of this. Every cost center pulls together a budget and submits it, and it's a lot of work for our managers. It's not an exercise they look forward to every year, but it's a very important one, and they really put their all into it. And so thanks to our entire management team, this is really a collective budget of all of their work. And then finally, to Kimberly Hart, she mentioned some of the trials and tribulations we've had over the last couple of years. And really, it's her leadership that got us through this unscathed. It's been very impressive to watch. The healthcare is very strong for having her during that time, and now we're ready to move forward with her vision. So thank you, Kimberly. It's been incredible. So, if we can get the slide up, Sri. So, every year, I like to put up the hospital's mission as we get into this, because it's really what guides everything we do here at the hospital, including the formulation of the budget. You know, the budget was prepared with our mission and its commitment to the patient-first ethic as its foundation. It is the financial embodiment of our mission and our commitment to our community, and allows us to move forward and do what we do every day for the people of the healthcare district. So, again, the mission is really what drives the budget. You know, early in the pandemic, the federal, state, and county governments moved really very quickly to provide financial support to hospitals that were struggling under the financial strain caused by the pandemic. Several relief programs were brought quickly and really helped hospitals who were struggling with obtaining personal, PPE, personal protective equipment, basic supplies, and COVID vaccines and medicines. The federal government also came to the rescue, providing significant financial assistance to hospitals and others who were having difficulties managing economic losses that were caused by significant volume reductions in key revenue-generating areas of healthcare systems and escalating costs. Some of those problems that we were dealing with are, for instance, orders to cease elective procedures in operating rooms and Cath labs. We had reduced emergency department visits. People were afraid to come to the emergency room early on in this pandemic. Fear in general of coming to the hospital as well. There were so many unknowns early on that there was a lot of fear in the community. Also, increased labor costs and supply costs have been really a part of the biggest problem that we've been dealing with over the last 2 years. As we had supply shortages, we had distribution problems. You've heard all of that. It was a tough time. But by the end of the first year of the pandemic, Washington Hospital really began to move towards self-reliance instead of depending on government assistance. Very limited federal funding was made available in the second year. And although we were still dealing with supply shortages, we were able to move back to more traditional sources of PPE and supplies. So we've lived through a historic time these last couple of years, and it's pretty clear, as Kimberly mentioned, that COVID-19 is here to stay, at least for the foreseeable future. But now it's time for us to move on. We're extremely grateful for the assistance we've received from governmental entities at all levels. Without that help, we could be having a very different discussion tonight. We've learned an enormous amount about dealing with this disease, and as Kimberly mentioned, incorporated those learnings into our day-to-day operations, and we've moved well beyond crisis mode at this point. Now that we've stabilized, we want to turn our attention to building the infrastructure for the long-term success of the healthcare system. We'll be facing some new headwinds in fiscal year 2023 as the economic damage caused by the pandemic and the war in Ukraine continues to manifest itself in the form of inflation, higher interest rates, and, perhaps a recession. We'll also be facing an extremely tight labor market, making recruitment and retention difficult and driving labor costs up. The next set of challenges we face at Washington Hospital, as I mentioned, are the economic pressures that have resulted from the pandemic and that war in Ukraine. Supply chain disruptions persist and are still resulting in shortages of goods and services of all kinds. Tight labor markets and wage inflation are prevalent across the country. These conditions, which at first were considered transitory, now appear to be entrenched. And we're in a period characterized by high supply and labor inflation and with the potential of a recession, as I mentioned. So how long these conditions are going to persist, it's difficult to determine, but it makes the work we've been doing to strengthen our healthcare system all the more important. Recruitment and retention is a big challenge in the coming year. The Great Recession and the resulting reduction in the workforce has created an extremely tight labor market, with unemployment levels close to 2019 levels at this point. Recruitment and retention is difficult at best. Our staff turnover rate has increased significantly. For years, that rate hovered at about 12.5% and really didn't move. But currently, we're at about 19.7% turnover rate. And again, it's just a function of the current labor environment. Hospitals throughout the region are experiencing serious staff shortages. And with fierce competition for physicians in the Bay Area, we found it necessary to make significant market-based compensation adjustments for our hospital-based physicians in order to retain them. We've seen significant year-over-year improvements in our financials this year because of a lot of the hard work we've been doing for the past year. And we expect that to carry into fiscal 2023. Over the past year, we've worked extremely hard at implementing a number of improvement initiatives to bring Washington Hospital to a new state of stability, both operational and financially. We're back on solid ground, but as Kimberly mentioned, our work is not done. During the coming year, we'll continue to work on improvement initiatives to improve our efficiency and create a better experience for our patients. We'll also begin building the foundation for the success of Washington Hospital for decades to come. One of the headwinds that we face, frankly, every year is the issue of poor payment from the Medicare and Medi-Cal programs. These programs have never covered the cost of providing care to Medicare and Medi-Cal beneficiaries. In fiscal 22, we estimate that the reimbursement from these programs was $143.1 million less than our cost to provide care to those government-sponsored patients. And while the government stepped up during the pandemic, they're now talking again about reducing payment once again. The talk right now is reinstating the 2% sequestration cuts that they had suspended during the pandemic. So with government-sponsored patients making up a majority of our business, it's a difficult calculus to deal with in the face of the inflation we are facing for goods, services, and labor. Our strategic map provides a guiding light and focus as we prepare Washington Hospital for the future. The key initiatives are closely tied to our short-term and long-term plans for ensuring that the hospital built by the residents of the district decades ago will be here to serve their needs for decades to come. The initiatives include creating and implementing growth strategies to strengthen key services that the district residents rely upon, and building infrastructure and expanding services required to stay relevant to district residents as the population grows. Other strategic map initiatives include securing the trauma designation we've been working toward so district residents can receive those services in their own community instead of having to go south to San Jose or north up to Castro Valley or Oakland. They include investments in technology, equipment, staff, and physicians to ensure our patients are receiving the best care that can be provided. And they require focus on utilization management and revenue cycle strategies to drive continuous improvement in quality and safety for our patients and to provide the financial security needed by the healthcare system to grow and thrive. So here's what the fiscal 2023 budget provides for. And Erica will get into the details of all this for you in just a moment. So we have total operating revenue budgeted of $533.3 million. Funding of capital equipment, information technology and facility spending of $47.3 million. funding of $11.2 million into our pension and post-retirement benefit plans. It provides for the debt service on our revenue and general obligation bonds, and also provides for the tax revenue to support the debt service on our general obligation bonds that the district residents so graciously gave to us. It targets hospital operating income of $22.5 million, earnings before interest, taxes, depreciation, and amortization of $67.8 million, and total net income for the hospital of $25.2 million. The budget provides for the funding of $23.1 million for affiliate operations, and it allows for compliance with all of our debt covenants, with a debt service coverage estimated at 4.6 to 1. So with that, I will turn the presentation over to Erica, and she'll walk you through the numbers. Okay.
Thank you. Thank you, everyone, and good evening. Before I get started, I just wanted to second kind of the thank yous that Chris mentioned. You know, we really rely on this executive team and the hospital management team for their thoughtful input, and also to the finance team who put a lot of long hours into putting this budget together. So just want to make sure I said thank you for that, and to Chris and Kimberly for their leadership and support throughout this process. It's a long process, and sometimes it can get tedious, like Chris mentioned, but it's an important process, and we're thankful for all the support that this whole leadership team readily gives to us as we put this together. So thank you again. With that, I'll get into the income statement. Just a quick overview of the income statement, and as we go through the rest of the slides, we'll get into more detail. But here's a quick look. Total operating revenue of $533.3 million. Total operating expenses of $510.8 million results in EBITDA of $67.8 million for the year, with estimated net income from operations of $22.5 million for Washington Hospital. After taking into account interest expense and other non-operating income and expenses, we estimate a total bottom line for the hospital of $25.2 million. And after adding in the results from our affiliate organizations, we estimate consolidated EBITDA of $46.6 million and a consolidated bottom line of $576,000 for the year. Moving into the budget assumptions, these are the assumptions that really drove the budget for the year. As the pandemic situation improves, we expect volumes to mostly remain consistent with the current year, with the exception of a few areas outlined here. Patient days are expected to decrease, with a decrease in average length of stay resulting from operational improvement work being done in utilization management. One of the key initiatives, as mentioned by Chris and Kimberly earlier in the presentation, and you'll see throughout the presentation as well. Surgical cases that will be impacted by the outmigration of cases to the ambulatory surgery setting result in surgeries coming down by about 6%. We do anticipate growth in Cath lab of 8%, and as I mentioned, we'll get into more details as we go. In terms of expenses, the inflation assumptions are outlined on the slide, include salaries, wages, and benefits ranging from 3 to 5%. Pension expense is budgeted based on the most current actuarial reports. Pharmacy, medical, and other supplies are anticipated to have about 3.5% inflation. Purchase services and professional fees are zero-based. The inflation on utilities ranges from between 5 and 10%, and insurance continues to have significant inflation at 25%, like we've seen in the past couple years. This is due to premium rate increases on both the hospital comprehensive liability insurance and on property insurance due to a combination of factors. Industry-wide, catastrophic losses nationally and globally over the last few years continue to push up the cost of inflation. The next several slides are volume trends and graphs. Starting with admissions. Admissions are expected to increase 1% due to the growth in inpatient Cath lab cases We also expect growth in cardiac surgeries and neurosurgeries, but this will be offset by the continued, or partially offset by the continued shift in joint replacement cases from inpatient to outpatient. We're still seeing that happen at a more significant rate. As you can see on the graph, you can see the decrease in admissions as more joint replacement cases were performed as outpatients rather than admitted to the hospital. You'll see the impact of this shift again when we discuss average length of stay in a future slide. Fiscal 21 was also impacted by the pandemic fear of coming to the hospital, but we have started to see that trend reverse, and we saw more admissions in fiscal 22 and expect to see an increase in fiscal 23 as we focus on growing our inpatient OR and Cath lab services. Moving into admissions by payer. We are not expecting or budgeting any significant changes in the payer mix. It's pretty consistent with the trend. However, this can change with changes in the economy. If there are widespread layoffs with economic downturn, we could see an increase in the uninsured or underinsured population. For example, Tesla recently announced potential layoffs, and over the last 12 months, we did see about 1,700 encounters, patient encounters of people employed by Tesla. So you can see how that can change. Patient days. Normally, patient days would correlate more closely with admissions. However, patient days are expected to decrease by 6%. This is as a result of the improvement work and utilization management undertaken to continue to improve length of stay for better patient outcomes. The improvement work involves people from all levels of the organization, including physicians, and will improve quality, operational, and financial results. Average daily census mirrors that trend and is directly correlated to patient days as well as average length of stay. This slide shows the average daily census for each year. The trend is consistent with the patient days trend and even and consistent with the average length of stay trend that we will see in the next slide, since the same drivers that influence patient days and average length of stay also impact ADC. The average length of stay is budgeted at 5.56 and is expected to decrease by 5% compared to the current year projection. As mentioned, we expect the work and utilization management to drive the improvement in this area. As you can see on the graphs, average length of stay was lower in fiscal 20 as there were a lot more inpatient joint cases at that time, and joint cases have a lower length of stay. As joint replacement cases shifted to the outpatient, you can see the increase in the overall average length of stay. Fiscal 21 and 22 were also impacted by the influx of COVID-19 cases, which generally have a longer length of stay, and particularly in fiscal 21, patients were delaying care, as you'll see again in the ER trend, and because they delayed care, they were sicker and had to be hospitalized longer. In fiscal 23, with the work being done, we do expect to see this to start to trend downward again. Outpatient observation days are expected to decrease by 3% as we work on processes to admit or discharge patients more timely. Moving into deliveries. Deliveries are expected to remain consistent with the fiscal 22 projection. Maternal child health is an area that we continue to focus on. However, the birth rate dipped even further down during the pandemic and may remain low given the potential for an economic downturn. Moving into surgical cases. Surgical cases overall are expected to decrease by 6%. This reflects the decline in joint replacement surgeries and other surgeries due to these cases moving out of the hospital setting into the ambulatory surgery setting. The decline is partially offset by growth in the inpatient cardiac program as well as growth in neurosurgeries. You can see on the trend in fiscal 20, we were impacted by the mandatory shelter-in-place orders at the onset of COVID, with many elective cases having to be postponed or canceled. Surgeries have increased steadily since 2020, and while we continue to see growth in this product line, the outmigration of cases to the ambulatory setting will reverse the trend in 23. It's important to note that even though cases are migrating out of the hospital setting, they are staying within the health system, which is a positive thing. More details on surgeries will continue on the next couple slides, 23. Total cath lab cases. Cath lab cases are expected to increase overall by 8%. This reflects growth in the cardiac cath lab program as well as growth in the neuroradiology cases. As noted on the previous slide, in fiscal 20, the mandatory shelter-in-place orders also impacted cath lab. Cath lab cases have increased steadily from 2020, and we expect that trend to continue in 23. More detail on surgeries and cath lab. As noted in the previous slide, surgical cases are expected to decrease overall by 6%, and here is the breakdown by category. Joint replacement cases will decrease overall by 15% due to the outpatient joint cases migrating to the outpatient surgery center. However, we do expect growth in shoulder surgeries and in other joint replacement cases from newly recruited orthopedic surgeons. Cardiac surgical is expected to increase by 12%. In 2020, we began providing minimally invasive valve replacement surgery, also known as TAVR procedures. This program has continued to see steady growth since its inception, and we expect that to continue into fiscal year 23. Neurosurgical cases are expected to increase by 9%. A newly recruited neurosurgeon is starting to ramp up and see more patients that'll drive that increase there. Other surgical cases are expected to decrease by 1%, and this is impacted by the outmigration of cases to the outpatient surgery center, since certain joint cases are categorized as other surgeries. As noted on the previous slide, cath lab cases overall will increase 8%, and here's the breakdown by category. Cardiac cases to increase 15%. We have ramping up of newer physicians and a newly recruited physician driving the increase in that category. Peripheral vascular is to remain consistent with the fiscal 22 projection. There has been some physician turnover in this service line, and we are in the process of recruiting new physicians to the program. However, there will be a transition period, so we expect the volumes there to remain consistent with the projection. Neuroradiology cases are expected to increase 28%. We are continuing to market this service line and expect to see growth in fiscal 23. Non-vascular IR cases are expected to increase 3% in line with physician expectations in this program. Emergency room visits are budgeted to remain consistent at 54,467 visits for the year. In fiscal 22, ER visits have bounced back and even surpassed pre-COVID levels, and we expect them to remain consistent in fiscal 23. You can see from the graphs how the pandemic impacted fiscal 20 and 21. It is especially noticeable in 21 when ER visits remained very low month after month due to the pandemic fears about coming to the ER. We did see visits come back strong in 22, and we're budgeting for them to remain at that level. Outpatient visits are expected to slightly increase by 853 visits. Similar to ER visits, these have bounced back mostly to levels, and we expect them to remain at this level in 23. The trend here is similar to what we saw with ER visits, except the dip in fiscal 20 was more pronounced in outpatient visits with the shutdown of elective services in fiscal 20. Outpatient visits have steadily increased since then, and we do expect a slight increase in fiscal 23. I'll move into the finance slide. Productivity indicators. Total FTEs at 1,558 FTEs represents a decrease of 28.9 FTEs from the current year. The budgeted decreases in volumes, including the migration of OR cases to the outpatient surgery center, the decrease in patient days related to the work being done in utilization management, were partially offset by increases in cath lab, neuro, and cardiac cases, but overall resulted in lower FTEs required. The lower FTEs driven by volume is partially offset by increases in FTEs due to the new grad program, including OR and cath lab RN training programs, and new FTEs related to the initiatives in quality, social services, CDI, and case management. FTEs per AOB are increasing, however, by 4.8%. The budget includes filling of open positions that resulted in lower FTEs in fiscal '22, particularly during high census periods when positions were difficult to fill and the use of incentives and premium pay were required, given the tight labor market and lack of staffing available. Patient service revenue. Gross patient revenue is budgeted to decrease by $45.8 million or 2% compared to the current year. This is driven by the outmigration of joint replacement cases and the decrease in patient days resulting from the improvement work, as discussed earlier. Contractual allowance as a percent of gross charges is expected to be 75.1% compared to 76.1% in fiscal '22. The improvement is due to negotiated rate increases from commercial payers, as well as the ongoing work being done in care coordination, utilization management, and patient financial services. Net patient service revenue at $527.1 million represents a 1.5% increase from the current year. Net patient service revenue graph. This graph shows the trend of net patient revenue and is consistent with the volume trends. It shows continued improvement as we recover from the impact of COVID-19 in fiscal '20 and '21, and as we work to lay the groundwork for future growth. Other operating revenue is increasing by 5.7%, driven by increases in the cafeteria and catering services, as we expect an increase in sales revenue as the visitor policy opens back up and there's more public utilization of the cafeteria. Health and wellness services are expected to ramp back up post-COVID. Outside services are increasing. The increase here reflects the management services that will be provided to the new joint venture between Washington Hospital and UCSF that will expand the oncology program, bringing world-class cancer care to our community. Quality incentive program will be increasing 2%. The quality incentive pool administered by the state is a pay-for-performance program available to public hospitals designed to improve quality care for Medi-Cal patients. Washington Hospital is a top performer in this program. Other revenue is expected to decrease with the reduction in supply chain rebates, as we are budgeting for lower supply expenses in fiscal '23, which we'll review in the next slide. Operating expense summary. Overall, operating expenses are projected to increase or budgeted to increase by 2.8%. Labor costs are expected to increase by 1.3% due to wage inflation being partially offset by the reduction of FTEs resulting from lower patient days. Employee benefits are expected to increase 9.6% due to a net actuarial gain on the pension plan in fiscal '22 that is not expected to reoccur in fiscal '23. We also expect increases in healthcare, dental, and vision expense. Professional fees are expected to increase 13.8% due to the market-based compensation increases required to retain hospital-based physicians, medical directors, and physician advisors. We also expect increases in legal and audit services. Supplies are expected to decrease by 4.4%. This is due to the outmigration of joint replacement cases to the outpatient surgery center and the implementation of several cost-saving initiatives. The decreases in costs are expected to offset the inflation in supplies and pharmaceutical expense. Purchase services are expected to increase 8.6%. Services retained for improvements in patient financial services, including the simplification of our charge description master and other claims activities, as well as increased costs related to staff training and upcoming district elections. Utilities are expected to increase 9.3% due to inflation in energy and waste collection services. As mentioned earlier, insurance is expected to increase by 25% due to the premium rate increases in both hospital, comprehensive liability insurance, and property insurance. Marketing and advertising is expected to increase 69%. This is due to a new campaign for the cardiac program. Software license and maintenance is increasing 2.9%, mostly due to inflation. These are important maintenance and licenses to keep our systems operating optimally and safely. Other expenses are increasing 16%, mostly due to the anticipated cost in preparation to become a Level 2 trauma center. Depreciation is decreasing 2.3% due to existing fixed assets becoming fully amortized in the current year. This is partially offset by the depreciation expense associated with new capital expenditures during the year. Operating expense distribution for the year 23 budget shows the distribution of our expenses. Labor, including salaries, wages, and benefits, represents the largest portion at 60% of the total. This is mostly consistent with fiscal 22, other than supplies that decreased from 14 to 13%, and pro fees and purchase services that increased from 12 to 13%. All other categories remain the same. Earnings before interest, taxes, depreciation, and amortization. Hospital EBITDA is budgeted at $67.8 million, 9.7% lower than fiscal 22. The decline in EBITDA is as a result of the increase in operating expenses, particularly in labor and professional fees, as discussed in the previous slide. Non-operating income and expense. Investment income expected to increase 1% due to higher balances earning interest. GO bond property tax revenue at $18.2 million is 5.2% higher due to the new GO bond issued in April of 2022. Interest expense is budgeted to increase by 2.3%. This is again due to the new GO bond issued in April. Rental income at $1 million is higher than the projection due to new tenants anticipated in Fremont Office Center and Washington property. There are no bond issues anticipated in fiscal 23, therefore no bond issuance costs are budgeted. However, we will start planning for the next bond issue in the fourth quarter of fiscal 23. Foundation donations at $2,250,000 are 118% higher than fiscal 22 due to the Cancer Care and Infusion Center capital campaign. The funds raised will expand the Washington UCSF Cancer Center in partnership with UCSF, making world-class holistic cancer care more accessible to our community. Federal subsidies are not budgeted in fiscal 23, as there is currently no indication that any federal COVID-19 relief funds will be made available to the health system. Gains and losses on sale of investments. We do not budget realized or unrealized gains or losses due to the unpredictability in financial markets. Moving into the capital slides, fiscal 23 capital spending. New capital requests total $30.6 million for the year. Committed capital, which includes approved projects with anticipated spending in fiscal 23, total $16.7 million. The combined total for new and committed capital is $47.3 million for fiscal 23. The sources of funding include GO bond financing, listed below, revenue bond project funds available, donations from the charitable foundation, and funds from operations. This slide includes the detail of the major movable, fixed, and IT capital equipment requested. They make up $5.5 million of the total requested and include vital equipment to replace existing equipment that must be replaced routinely in order to continue to provide the level of care required. This slide includes the detail of the new facility projects and IT projects that will be coming for your consideration during the year. The amounts shown reflect the anticipated spending for fiscal '23. The total amount for the projects may vary. The total cost of the projects will be included as items are brought forward for consideration. It includes new software and upgrades to existing software needed to keep our IT systems current and safe. It also includes construction projects required as we lay the foundation for future growth. That concludes the budget presentation. Happy to take any questions at this time.
Any questions?
Well, I have a comment and then a question. I think it's an incredible amount of work which has gone into preparing this budget. Just a lot of uncertainty that we've been through in the last 2 years and the uncertainty that we have ahead of us. So I've got a question for Chris, and of course I'm going to ask him to get out his crystal ball.
I need to find a new store for those.
I know you keep
Mine are all
polishing it,
defective.
Chris, but it's still cloudy. It's still cloudy. And I can see that there's been a lot of very careful analysis and decision-making on the assumptions which go into making up the budget. I guess my question to you is what keeps you up the most at night? What is the area within the budget where you see the most uncertainty with respect to how this next fiscal year is going to turn out for us?
I would have to respond to that question, Dr. Nicholson, with, really what's happening economically. We're seeing this continued growth in inflation. We're seeing this incredibly tight labor market. Unemployment in the district is 2.5%. And the number of unfilled jobs in the district and in the county and in the state and really nationally far exceeds the number of workers that are currently participating in the market. And if we enter a recession and we start seeing large-scale layoffs, that's the kind of thing that keeps me up at night, is the uncertainty around all of that. And, we're just, we build these budgets and we try to be conservative and not overly optimistic, but not overly unoptimistic. And it's just something that we're really going to have to watch every day and keep an eye on what's happening in the community and in the surrounding region and adjust quickly if needed. So, those are the things that keep me up at night. It's the things that I can't get my hands around and grab that keep me awake. We believe that our numbers are solid and conservative, but economic conditions can change very quickly, as we've seen with this war in the Ukraine. So, Kimberly, you might have some comments on that as well.
Yeah, I mean, the piece that I agree with, it's the recruitment and the retention. We're a standalone community hospital here for the community. We're not part of a larger system that can move employees around from different areas. So it's really, we're very much impacted by what is happening in our local community. And so I think that's the uncertainty that keeps me up at night in terms of really what are those greater forces on the community impacts that will then have an impact on Washington.
Yeah, I share your concern about the stressors we have with respect to staffing the hospital to meet the needs of our patients. I think that's going to be a tremendous challenge, no matter what happens in the economic environment. I think the one good thing, absolutely the one wonderful and shining thing that we have to get us through this next year is the great leadership that we have with Kimberly, the administrative team, and all of the staff that really showed itself during COVID, in which we showed the ability to respond in a very agile fashion to changes that were happening in a day by day, week by week, and month by month time frame. It was really beautiful to see that. So I know we've learned a lot in the last 2 years with COVID, and let's see what we're going to have to learn in the next 2 years with the financial and inflation and other headwinds that face us.
Thank you, Dr. Nicholson.
I'd like to just say a few things. First of all, I think it's very, very important to congratulate our team on what's been accomplished, both from surviving COVID to now presenting budgets and moving ahead. I don't think any of us really comprehend how amount of work it is to present one of these budgets. And I just thank you all for all that you do. It's impressive what you've done. It does, as difficult as things are, as many challenges as we have, it does give me some confidence and some hope that based on past performance, we're going to be able to manage the things ahead of us. Tremendous challenges. And I just appreciate the work. I appreciate the capabilities, the strength that is in our administrative and other groups to get us through this and to keep Washington Hospital moving forward in a positive way. Thank you. Thank you very much.
I just want to echo my fellow board members and expressing my thanks and admiration for what you do. I feel like the hospital is your patient and you're doing everything you can to keep her alive. And that's keeping the doors open to meet the healthcare needs of our district residents in spite of things being so challenging and unpredictable. So we thank you, Chris and Erica. Thank you to your team for year-round making sure that we have the funds needed to keep the doors open. We know it's not an easy task, but what you do is so important, and we're grateful. We have seen you work wonders and anticipate and make wise decisions for us, and we're counting on you for the future. And we are grateful to have you as part of the team.
It's everybody in the organization that makes those numbers what they are, and you know, it truly is a team effort here. It truly is.
Well, let's just continue to stick together. Thank you very much. Well, then, may I go ahead and have a motion regarding the consideration of the resolution number 1243 for the budget estimate for fiscal year 23?
Yes, Madam President, in accordance with district law, policies, and procedures, I move for the adoption of resolution number 1243, which is the budget estimate for fiscal year 2022 through 2023. This resolution provides for the necessary funds required for the operation of the district and for the continued support of the Washington Township Hospital Development Corporation in its operations to promote the charitable and community service mission of the district.
Very good. Thank you. May I have a second, please?
Second.
Thank you.
Madam President,
Yes.
Paul Kozachenko,
Yes.
you could just ask whether there's anybody from the public that would like to comment on the budget before you go ahead and vote.
Oh, thank you very much, Paul.
Okay.
Is there anyone from the public that would like to make a statement? Okay, very good. Then hearing none, may we have a roll call, please?
Director Yee,
Aye.
Director Stewart,
Aye.
Director Wallace, Director Epen, Director Nicholson.
Aye.
Very good. So that motion passes. Thank you very much. Thank you again, Paul.
Thank you. Thank you to the board of directors for your support. We do appreciate
Yes.
it.
Thank you very much, and again, want to thank Erica and the finance team, the whole executive team, the VPs, and to recognize Chris for the many hours that it's taken to put all of this together. So thank you very much.
Wonderful. Thank you. Kimberly, announcements?
I do have one announcement that I just want to make sure that everybody is aware. You've probably heard that the FDA recently approved the Moderna and Pfizer COVID vaccine for 6 months through 4 years of age children. And it's our pleasure to announce that we will be offering the Pfizer vaccine, which is a 3-dose series. And we are taking appointments, so if you want to call our vaccine appointment line to schedule a time, it's 510-248-8200. So again, we will be offering this for the children, but then also we still are doing vaccines for the 5 to 11-year-olds and then above that too. So want to make sure that the community is aware that they can now schedule an appointment to have their child vaccinated.
Very good. Good news. Well, if there isn't anything further for discussion, we'll now move into closed session. However, before doing so, I want to let the public know that they have a right to know what reportable action, if any, was taken by the board during the closed session. Normally, the board would make that announcement following the closed session. But as we do not know how long the closed session will last, we don't want members of the public waiting indefinitely on the phone for the board's report. Therefore, we ask that you contact the district clerk tomorrow, and she'll be happy to respond to any inquiries about reportable board actions. Our minutes will continue to reflect any reportable actions taken. Thank you. The board will now adjourn to closed session.